President-elect Joe Biden says help is on the way. Yesterday, he spoke about his plan for his first days in office.
My inclination, Jake, is on the first day I'm inaugurated to say I'm going to ask the public for 100 days to mask. Just 100 days to mask. Not forever, 100 days. And I think we'll see a significant reduction if we occur that, if that occurs with vaccinations and masking to drive down the numbers considerably.
Joining me now is Associate Professor of Epidemiology at the Johns Hopkins Bloomberg School of Public Health, Carrie Altoff, live from Baltimore. Carrie, your thoughts on the President-elect's plan?
You know, we need some sort of action like this in order to do exactly what he said, drive down the number of cases. I personally would love to see this happen even sooner than January, because we are going to lose a lot of Americans between now and then. The idea here is to essentially just squash the virus as much as we can without squashing people's livelihoods. So masking is a really important tool that we have. But you know what? Let's start that now. As Americans, I know a lot of us are living in states where we do have calls from our leadership to wear masks when you're in public. So there's no need to wait.
I want to go through with you some of these just sobering numbers that we keep getting. I mean, they keep getting higher and higher. Record hospitalizations, as we just mentioned. Yesterday's COVID-related deaths exceeded 2,800. It's the equivalent of one person dying every 30 seconds, and every 6 days, 1 million new cases are added to the U.S. This is the pace that we've seen for weeks, and we're continuing to see it grow in the holiday season. Where do you see this going?
Well, clearly this is a really dangerous situation for a lot of people around our country, really for all of us. And, you know, this virus does what it does. And we know if this virus can find a host, it's going to infect that person and potentially lead to additional ongoing transmission. So our goal here is, you know, we got to get this thing stopped. We've got to get the cases back down. Our healthcare system is it's a very troubling time for healthcare providers and systems right now. People are exhausted. My husband is a clinician. He's been in the hospital all week. It is a really trying time. And so right now, what we need to do is get back to that enthusiasm, really get our second wind, to flatten that curve. We need to be able to protect the healthcare system, not just to decrease these COVID cases, but also thinking about the other viral illnesses that come about this time of year, influenza, for example. We need to be sure that we do have the healthcare resources available for other illnesses, people having heart attacks, influenza, et cetera. So really, it's time to heed that call and be sure that we are all on board for the second wind.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.